Greetings my dear friend, my name is Maxim and welcome to my channel, and today we are going to be discussing trimethylaminuria in great details. Well, without further ado, let's enjoy the lecture and dive into it. Trimethylaminuria is a rare metabolic disease caused by a mutation in the FMO3 gene. This genetic defect decreases the production of the enzyme flavin-containing monooxygenase 3, which leads to deficiencies in N-oxidation and an accumulation of trimethylamine in sweat, urine, and breath. Trimethylamine acts as a catalyst for the fish odor syndrome. Primary Tmau is due to genetic disease affecting FMO3 function in the liver. However, symptoms can also be present without any underlying genetic factors, secondary Tmau. This can be triggered by excessive amounts of TMA precursors from one's diet, hormonal changes related to menstrual cycles, liver damage or failure, or kidney failure. Metabolic pathway. Consuming certain foods and supplements may lead to the presence of TMA in the body, predominantly found in seafood such as saltwater fish, shellfish, seaweed, kelp. Trimethylamine oxidative form is converted by bacteria in the lower GIT into trimethylamine. Additionally, substances containing a precursor like choline or carnitine may be converted to trimethylamine by gut bacteria. However, this depends on how much of these precursors are absorbed in the small intestine before reaching the gut. If a food substance or supplement rich in precursor overwhelms the capacity of absorption in the small intestine, it will end up in the gut, where bacteria can convert it to trimethylamine. TMA is absorbed into the bloodstream via the intestinal lining, at which point it is filtered by the liver. FMO3, an enzyme usually generated in abundance, works to oxidize TMA into smell-free trimethylamine oxidative form and send it on to the bladder. If there is insufficient FMO3 or too much TMA present, circulation of TMA will occur until a sufficient amount of enzyme is produced. Subsequently, trimethylamine leaves the body through body fluids. This includes sweat, saliva, reproductive fluids, and breath. There are no known interactions between trimethylamine and any internal organs or functions. Although lecithin, creatinine, and betaine are technically precursors to TMA, studies have shown no significant effect on the production of excess TMA-TMAO ratio in urinary analysis at normal dietary levels. Symptoms. In infants, fish smelling urine, primary symptom. When the concentration of trimethylamine is high enough to be detected, the person's sweat, reproductive fluids, and breath will also emit a fishy odor. Intensity of smell is directly proportional to the blood concentration of trimethylamine. Scientists suspect that such female sex hormones as progesterone and estrogen aggravate the condition, which seems to be more common in women than in men. The condition worsens around puberty. Symptoms may worsen just before or during menstrual periods, after taking oral contraceptive pills, or around menopause. The disease is inherited in an autosomal recessive pattern, meaning 2 copies of the gene are altered in each cell. The carrier may experience mild symptoms or temporary episodes of fishy odor. Mutation in the FMO3 gene located on chromosome number 1 long arm. the FMO3 enzyme usually transforms the fishy-smelling trimethylamine into odorless trimethylamine N-oxide. Tmau is associated with more than 40 mutations, including loss of function, nonsense mutations, missense mutations are 3 most common. Screening tests: urine test for Tmau ratio, blood test for genetic analysis. Important points. It is possible to obtain false positive results in the urine if elevated Tma is present without any underlying Tmau. Infections of the urinary tract, bacterial vaginosis, cervical cancer, advanced liver or kidney diseases. A similar foul-smelling urine odor has also been associated with a bacterium called Aerococcus urinae, colonizing the urinary tract, especially in children. Treatment: for primary Tmau, no permanent cure or treatment, only mitigation of the symptoms. Secondary Tmau, plant-based diet, clinical review by a doctor, and decrease precursors intake. The disease can lead to a social isolation, poor self-worth, depression, paranoid behavior, and even suicide. The following methods can be used to reduce the fishy odor: reduce seafood, red meat due to carnitine, increase plant-based diet, modify gut microbiome, making it harder for choline and carnitine to be converted into trimethylamine, reduce liver, carnitine, and fish consumption, as well as egg yolks, legumes, and beans. Although choline is an essential nutrient and it should not be completely eliminated from the diet, chicken or turkey may be eaten. Soy sauce, tofu, soy milk have a low choline concentration. Vitamin B2 combined with diet resolves odor issues in some studies. The use of low-dose antibiotics such as neomycin and metronidazole decrease the amount of bacteria in the gut. This is not recommended. Body washes and detergents with a pH of 5.5–6.5 can be used. Important points: activated charcoal and copper chlorophyll on a daily basis may temporarily improve the quality of life by oxidizing trimethylamine. Well folks, this is all what I have for you today. Thank you for watching. I wish you a very lovely day and see you guys later. Goodbye.